So we have a very interesting case to discuss today. In this case, gentleman presented to my clinic with a lot of complaints, including fatigue, brain fog, dizziness, and also history of intolerance to cholesterol medications, and thus very high cholesterol. So in this case, we'll talk about his cholesterol and maybe the reasons why his cholesterol may not be optimal, and also will be linked to his other complaints. As you can see on this test, pretty much everything is abnormal. He has extraordinarily high LDL particle numbers. He has a very low HDL particle numbers. He has a very high total cholesterol. But also he has a very high triglycerides. And as we discussed in the previous videos, high triglycerides means a very high intake of sugars. Patient is a semi-vegetarian. He eats very limited proteins, mostly eggs, and occasionally some other meats. But vast majority of his meals are vegetarian meals. So you can see that his insulin resistance score is also extremely high. So clearly he has significant insulin resistance, but his A1C, as you can see in this video, is completely normal. So he's not even pre-diabetic. He just has a preclinical insulin resistance. But that causes a considerable issue with his cholesterol and his triglycerides. But how do we explain his extraordinary high LDLs? Well, if we look at his thyroid is very abnormal. His TSH is very high, but that's a brain hormone. And he is on a very low dose of thyroid medications. But because of that, his levels of T3 and T4 are actually low normal. They should be much higher when patients are replacing their medications. Your LDL receptor is controlled by T3. So if you do not have enough T3 hormone in your body, you're not going to be able to absorb all the cholesterol in your cells. In addition to that, that gentleman is obese and has sleep apnea. So likely he also has a pretty significantly low testosterone. And if you have low testosterone, your body will automatically try to increase your cholesterol to try to produce more testosterone as a compensatory factor. So there are multiple different things that we need to look at when you look at cholesterol, not only the cholesterol, but also hormonal levels, your thyroid levels, your testosterone levels, and obviously your insulin, to figure out why you have high cholesterol, because that will allow us to address them by different ways. This gentleman, for example, is not tolerant to statins, so nobody's going to start him on that. So we need to figure out what are the alternatives for him. And there are multiple alternatives for him, and we'll need to address them as much as we can. Follow me for more, share with us who are in similar situation, and like this video.